Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Zonda inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition with the risk of side effects. You'll need to have the capsules that came with your Zonda inhaler ready before using the inhaler. It's important that these capsules are only used in the Zonda inhaler. Do not use any other inhaler to take the capsules. Do not use the Zonda inhaler to take any other medication. And do not swallow the capsules. Begin by opening the dust cap by lifting it upwards. Open the mouthpiece by pulling it upwards using the lip at the edge of the mouthpiece. You'll see a compartment for a capsule underneath. Remove a single capsule from the bottle immediately before use and place it into the compartment in the base of the inhaler. Never place a capsule directly into the mouthpiece. This is to avoid the risk of choking. Close the mouthpiece until you hear it click. Leave the dust cap open. Hold the inhaler with the mouthpiece facing up. Press the piercing button in completely, only once, and release. When you're ready, breathe out as gently and as far as you comfortably can, but not into the mouthpiece. Now place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Take a slow and deep breath in through your mouth so that the capsule vibrates inside the inhaler. Remove the inhaler from your mouth while holding your breath for as long as is comfortable. Then breathe normally away from the mouthpiece. To make sure that you've inhaled all of the medication from the capsule, you must repeat the process again. Breathe out fully, put the inhaler in your mouth, breathe in slowly and deeply, hold your breath, and then breathe out away from the mouthpiece as you did before. You can check that you've inhaled all of the medication by opening the mouthpiece and looking through the clear capsule to see if it's empty. You can throw away the used capsule in your normal waste bin. Close the inhaler by clicking the mouthpiece and then the dust cap back into place. Make sure that the bottle containing the capsules is closed tightly. Never store a capsule in the Zonda inhaler. You'll get a new inhaler with each new bottle of capsules, so do not reuse your inhaler after you've finished all of the capsules in one pack. Lots of pharmacies can send old inhalers to be recycled. Ask your pharmacist for information. If you're unsure about how to use your Zonda inhaler or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.